Okay, you're good? Okay. I'm here with, your name was?
Angela Nix.
Angela Nix, she's the Assistant Director of the VA, and we're just gonna ask her a couple questions about the VA and its budget and what's going on.
Okay.
So how is it looking to get our VA hospital if we want so bad here?
Well, I don't know what the, I don't really know where it is right now. All of that has to come down from Congress. It has to get approval as a line item in the national budget. So at a local level, our veterans, we always say, they are the voice of the VA down here. They're probably our biggest supporters. So all we can say is that they keep supporting that effort, that they want a hospital down here. Hopefully it reaches our congressional affiliates up in Washington.
Okay. The second question is, in an article in the Monitor back in 2009, it was reported that the Valley would get its own budget and office. Has it happened yet?
Well, it has. We have had our own budget since 2010, actually, in 09. See, I came here in May of 09. We were still under San Antonio, and we do have our own leadership here on site. We have 3 facilities here in the Harlingen area. All of our leadership are based out of the Harlingen area. We do have some service chiefs in the McAllen area and Corpus Christi, but we do have our own budget, and we are our own healthcare system now.
And then, Avento, you can come and ask the rest of the questions.
Did you brush your hair? You're looking good. You're looking good.
I just shouted. Alright, well, the next question is, what is the benefit of having our own VA hospital here in the Valley?
The benefit of having our hospital? Well, I mean, right now, the veterans have 7 access points for inpatient care throughout the Valley. The one benefit that they would have with a VA hospital is just the better coordination, or easier coordination, should I say. All their records would be within our one medical record. Right now, we do coordinate very closely with Valley Baptist Health System and South Texas Health System. They're sort of like our virtual VA healthcare system. So we do have the benefit, even now, even though we don't have a true bricks and mortar VA hospital, we do have the benefit of having a virtual VA hospitals all throughout the Valley area.
And do y'all know what that means exactly?
The virtual
virtual.
Yeah, because what we have right now in our
Yeah, come on
in
through.
the Rio Grande Valley is we do understand that there are veterans that would prefer to have a VA hospital. But what's good about the current setup we have now is that we contract out for inpatient care and emergency room care and behavioral inpatient care. So right now, veterans can access McAllen Medical Center in McAllen. They can access Edinburgh Regional Medical Center in Edinburgh, Valley Baptist here in Harlingen, and also Valley Baptist over in Brownsville. So in total, they have 7 points of access to get emergency care, inpatient care, and behavioral health inpatient care. So instead of having maybe one localized hospital, they have multiple access points so that a veteran doesn't necessarily have to travel from Brownsville all the way to McAllen to receive care. We can still easily access that care in Brownsville. Same goes for the Harlingen area veterans, McAllen area veterans. So right now it's a really neat setup that we have that lots of veterans take advantage of.
It's very unique, and we're the only one like it in the country.
That's awesome. We're the first in the Valley.
That's right, we're the first, exactly.
Okay, the second
Next question is, what is going on with Proposition 8?
Proposition 8 is a state initiative, and it's for all state inquiries or state partners. So it's specifically in reference to
the hospital. Trying to get the hospital.
It may or may not be. I'm not too sure what I think Proposition 8 is about. But I would probably check in with your state legislator, your state reps, state senators, and or the Texas Veterans Commission.
Yeah, because Proposition 8 was basically saying there's federal money getting from Congress federal to provide us with basically like the hospital we need.
Yeah,
So
and if I recall correctly, it was a state fund that it pulled from, I think, enterprise
something like that.
And so we'd probably refer that right back over to the author of that legislation. I believe it might have been Representative Martinez.
Oh, okay, so basically who would be okay.
Last one is, a bill was sent to Congress to help the Valley get its own hospital but was declined due to budget cuts. How has this affected?
It actually wasn't declining due to budget.
Right.
It just wasn't moved out of the committee. So in order for a bill to move out of a congressional committee, it has to be brought up to the committee has to vote on it, and then it gets forwarded to the floor for a vote. So lots of different mechanisms have to occur before that actually happens, and that unfortunately didn't occur with this particular
Okay, so it didn't get declined, it just got stuck in committee and then got closed out. Okay.
So it didn't have anything to do with budget or anything like that. Just mainly it did not get out of it.
That's awesome. Those were all the questions.
much better on camera than I am.
Yeah, very good. We got the stuff that we need. Thank you so
Thank
much.
All right, thank you. It was a pleasure meeting you, and hope to see you soon. And
Hopefully
one of
more
our
volunteers.
VAs working and is volunteers. Yeah, thank you.
Sir,
Thank you so
Appreciate
much.
y'all's time. And if I can get y'all to sign real quick.